my favorite.
It's so much better.
My name is Brittany Penny, and this is my informational speech.
Green apple?
There's just like
a green apple Gatorade?
there's just like the tricks.
I had it. We're not shapes anymore.
Tricks are for kids.
Are you going over here?
They're still shapes, we just can't see them.
No, I was getting out of the way of the camera.
Brandon needs a podium.
I do. Like a music stand.
Imagine you're out enjoying a jog on a beautiful spring day, something you do often. Suddenly you feel a tightness in your chest and difficulty breathing. You think that you must be working yourself too hard, so you slow down. But the tightness does not subside, and suddenly you feel an anxiety come over you, and like an elephant is sitting on your chest. You're having a heart attack. According to the American Heart Association website, coronary artery disease or heart disease is the leading cause of death in the U.S. for men and women of all races and ethnicities. Every year, heart disease kills more than 786,000 Americans, which is larger than the population of some states. Although heart disease is a life-threatening condition, it is preventable, manageable, and in some cases reversible. I developed an interest in heart disease while studying in nursing school, and I've learned a lot of information about this disease process. Today I'm going to tell you about heart disease, its risk factors, and prevention. First, let's start with discussing what heart disease actually is. The Center for Disease Control's official website explains that the most common cause of heart disease is atherosclerosis. This is a buildup of fatty substances in the blood vessels that supply blood to the heart. Too much buildup in narrow artery walls can make it harder for blood to flow through your body. As you can see in these photos, this is what a normal heart looks like, and this is what they call a fatty heart. You can see the fat builds up around the muscles in the artery walls compared to the healthy heart. Over time, this weakens the heart muscles and can lead to a myocardial infarction, more commonly known as a heart attack. There are signs that you may experience that could alert you that you may be having a coronary event. Some signs of heart disease can include chest pain, shortness of breath, numbness, pain in your jaw and your left arm, indigestion, and shortness, and sudden cardiac arrest, although some people may be completely free of symptoms prior to having a major coronary event. What puts you at risk for developing heart disease? According to Bruner and Sudar's textbook of medical surgical nursing, there are several factors that increase the chance that a person will develop heart disease. There are non-modifiable factors, which you cannot control, and then there are modifiable factors, which you can control. The non-modifiable factors include your family history of coronary artery disease, your age. Increasing age increases your chances that you will develop this condition. Your gender, men develop coronary artery disease at a younger age than women do, and your race. African Americans are more prone to the disease than Caucasians. Modifiable risk factors are the most important because they're the factors that you can control. These include high cholesterol, smoking, high blood pressure, diabetes, obesity, diet, and exercise. Talking about your risk factors leads us to the topic of preventing heart disease. Prevention involves these important modifiable risk factors. First is controlling your cholesterol, which is fat in the blood. Adults over the age of 20 should have a fasted lipid profile done at least once every 5 years. These results should reveal an LDL, which is your bad cholesterol, of less than 100, triglycerides less than 150, and a total cholesterol less than 200. HDL, which is your good cholesterol, should be greater than 40. Cholesterol levels are directly related to your diet and exercise habits, which we will discuss shortly. Next is the cessation of tobacco use or quitting smoking. Individuals who stop smoking decrease the risk of developing heart disease within the first year of quitting, and the risk continues to decrease with their continued cessation. It is also believed that exposure to secondhand smoke can cause heart disease in those who are non-smokers as well. Another modifiable risk factor is hypertension or high blood pressure. According to the National Institute of Health's website, high blood pressure is defined as blood pressure measurements that repeatedly read 140 over 90 or greater. Normal blood pressure is considered to be a reading of 120 over 80. The risk of developing heart disease is increased in people with consistently high blood pressure. Early detection of high blood pressure is key. Also, adherence to a prescribed medication plan, diet, and exercise to decrease and maintain blood pressure plays an important role in preventing heart disease. One of the most important prevention measures is diet and exercise. Diet and exercise play an important role in all of the previously mentioned modifiable factors. The American Heart Association recommends that everyday dietary choices should focus on a variety of fruits and vegetables, fiber-rich whole grains, poultry or fish, and low-fat dairy products. Lower your calories and saturated fats to maintain your cholesterol levels, cut back on added sugars, and choose foods with little to no salt. Reducing sodium plays a vital role in lowering blood pressure. Drink alcohol in moderation and avoid smoking at all costs. Exercise is also important because it contributes to weight loss and cholesterol levels and overall decreases your risk of a coronary event. Most adults should aim for a goal of at least 150 minutes of moderate physical activity to 70 or 75 minutes of vigorous physical activity each week. But of course, this can be tailored to meet your needs and physical abilities. I'm sure that most people in this room know of someone who has been affected by heart disease. It is stated by the American Heart Association that some form of cardiovascular disease affects more than 1 in every 3 adult Americans. So, let's take a look and recap some of the statistics of heart disease. Heart disease is the #1 cause of death in the United States. Every 39 seconds, someone dies from heart disease or stroke. 715,000 Americans have a heart attack each year, and only 27% of people are aware of all of the major heart attack symptoms. 66 for a man and 70 for a woman is the average age of a person's first heart attack. Losing only 10 pounds can reduce your heart attack disease risk by 50%. Half of Americans have at least one of the 3 key risk factors for heart disease, which would be high blood pressure, high LDL cholesterol, and smoking. And at least 200,000 deaths from heart disease and stroke each year are preventable. The main thing to remember is that heart disease is preventable. Take the time to know your risk factors and make changes where you can to aid in prevention. Whether it's lowering your blood pressure, finally deciding to quit smoking, or making even the smallest diet and exercise changes, each small change you make can significantly lower your risks of developing heart disease.
Yeah.